Hello everyone, I am Dr. Meenu Handa, the Clinical Director for IVF and Fertility at Cloudnine Hospital, Golf Course Road, Gurugram. Today we shall discuss about egg freezing, when is the best time and what are the factors that impact the success rate of an egg freezing. So egg freezing has now become a very common technology that is being offered for many reasons. The first more important reason is called as the fertility preservation technique. Now, unfortunately, as the number of cancers it's increasing in younger women and in younger patients, we know that they have to undergo something called as a chemotherapy, and that can completely destroy their fertility. So egg freezing comes as a boon for such patients where it can be offered and their fertility can be preserved. A second important reason is also social reasons, whereby the woman wants to delay her pregnancy, or she's not yet married, or she's divorced, and or maybe she's not found the right partner, but we know that the biological clock is ticking. We know that as we go beyond 35 years of age, that there is a rapid decline in the oocyte quality or the egg quality as well as the egg numbers, and that is where egg freezing would help such couples or such women. Now, third very important, another reason where we do egg freezing very commonly is in IVF cycles. For whatever reasons, when we not found or we do not get the sperms, sometimes we are doing sperm retrieval cases, or for whatever reason sperms are not available during the time of fertilization. That is a time when the woman need not waste her entire cycle and eggs can be frozen. So friends, these are a lot of reasons where egg freezing can be done. The most important thing that a lot of women ask us is that, ma'am, what is the success rate of egg freezing technology? So the success rate of this is dependent upon a very important factor, which is what was the age of the woman when she froze the eggs. So the age when you're coming for an egg freezing technology really determine the success rate of this technique. As you know that the younger we are, less than 30 years of age, the quality of the eggs, the good quality eggs is much higher, and that will result in a successful live pregnancy. So my friends, most important is the age, which is going to top the list of the success rates or the important factor impacting the success rate. Now, the number of good quality eggs that a woman chooses to freeze is another very important factor which determines the success of leading to a live birth from these frozen eggs. Now, this is basically simple maths. The more the number of good quality eggs frozen, the more the opportunity to get the live pregnancy. And also the more the opportunity for the embryologist and your doctors to have a better embryo or a good quality embryo that can be implanted in the uterus whenever you want the pregnancy. So the most important is the number of good quality eggs that a woman chooses to freeze. Now, how many eggs are needed to be frozen? That has been given by one of our medical journals of Fertility Sterility in 2017, came up with the basic statistics. And it was that any woman less than 30 years should freeze at least 15 good mature eggs to have a 80% pregnancy rate. Somebody from 35 to 37 would require to freeze at least 20 good quality eggs to get the similar pregnancy rate. So as we age, somebody more than 37 to 40 would need to freeze 30 eggs to get 75% success rate, and more than 40 years probably would have only a 50% success rate. So it's important that women needs to understand that the sooner they freeze the eggs, or their age is very important factor when they would need to freeze the eggs. So I hope you do understand the important factors impacting the success rate of egg freezing technology.